Have you ever wondered about a CO2 fractionated laser resurfacing treatment? I have too for years. In fact, I've always wondered and asked dermatologists that I've met and other doctors and physician friends of mine whether they thought it might be helpful in reducing the melasma that I've been dealing with since my early 20s, and then post-pregnancy melasma and just some major skin damage. Many of you know I'm from Florida, and so there are years, decades, sadly and embarrassingly, that I have not taken really good care of my skin. And regardless of my more natural tendencies now as a grown adult, it's nearly and virtually impossible to reverse some of the sun damage that I incurred and had on my face as a young child and teenager growing up on the beaches of sunny Florida. So I'm going to share with you this amazing natural, non-surgical laser resurfacing procedure that I recently had done. And I have to say, I'm super happy. Hey guys, I'm so excited to have you here on my journey of my skincare rejuvenation plan. As you guys can see, I just walked into the Laser Med Clinic here, and Dr. Jean Chapman and I are going to sit down. She's going to give me a consultation, and then we're going to get kicked off with my awesome CO2 laser resurfacing treatment. And you guys are going to get a special sneak peek into my treatment. I'm super excited to share this informative skincare video with you guys. Let's go.
As I'm assessing your skin, I think that fractionated CO2 treatment would be amazing for you.
Okay.
There is a mixture of a bit of sun damage from you growing up in Florida, and also some melasma, and upper lip area, and then maybe a little bit on the top of your forehead. The CO2 treatment, with it being just one treatment, will really tighten up your eyelids, some crepiness or soft wrinkles, and as well as give some tightening to our relaxing skin.
Good.
So it's just really one-time treatment that does it all.
Yay.
So that would be really good for you. And I know that you've been doing some pre-treatment, which includes hydroquinone, and especially melasma-prone patients can hyperpigment after a treatment that causes any inflammation. So this way we can prevent that, as well as using some zinc oxide-based sunscreen, which is a physical sunblock, so it will be a great thing to block UVA and B both. Okay. So you will continue that hydroquinone for another 6 weeks after the treatment. So you've done it for 2 weeks and then 6 more weeks afterwards, at which time the most of the inflammation should come down to where we can be confirmed that there won't be any PIH, which is post-inflammatory hyperpigmentation, and that we can be assured and let you start your regular skincare regimen.
Okay, excellent. Yay, I'm excited.
Yeah.
Well, friends, as you can see, I did not turn extremely red during the treatment. I will be honest with you, one of the things that I didn't really highlight in the video or explain, I chose not to have any of the pain medication or relaxing anti-anxiety meds. It's very common that you have 2 scripts that your doctor might write for you. As many of you know, my inclination is more to choose the natural route, and so I chose to use CBD therapy quite frequently the day before, the day of, and the days after to manage some of the pain and inflammation. And I'll be perfectly honest with you, I did feel the laser on my skin, but it wasn't anything extremely uncomfortable. And I even did the laser eye lift, which I think honestly is the most impactful, quite amazing, and crow's feet, wrinkle reducing treatment that is part of Dr. Jean's special treatment. I'm going to encourage you to check out Dr. Jean Chapman's office. They are offering a special. I'll include some details and information down below if you want to visit her med spa. It's a beautiful environment, and she is one of the nicest, most caring, compassionate doctors that I've ever worked with. And I'm so grateful to her and her entire staff. They're super amazing. Just her demeanor, she is so sweet and so kind. It really put a lot of my concerns at ease. She answered all my questions. I asked a ton of questions before the treatment, and then she allowed me and our crew to video for you guys so you could see what it looks like and what to expect. So I'm going to encourage you to watch the next series of videos here where I showcase my step-by-step healing process. Day by day, I do check-ins. I think you'll find that really beneficial. And then also I'll include a link of all the different things that I implemented, the dosing. It's basically my cosmetic surgery protocol, very similar to my surgical protocol, but obviously this is more condensed. This is a way for you to prepare the week before your procedure, the day of, and then weeks after. So you maximize your healing, minimize your inflammation, minimize your swelling, and obviously the pain, because that does come with these types of procedures. And I want to thank each and every one of you viewers for, one, your encouragement, because this is definitely more of an elective cosmetic and superficial type of procedure. For me, it made me feel really great, and I felt I gained some more self-esteem and self-confidence when it comes to the melasma. I'm not wearing the type of makeup that I've been wearing on camera, which I think that's pretty impactful. As many of you know, my personal preference is to not have to wear makeup or even wear makeup on camera if I don't have to. So not only was this procedure superficial and obviously helping kind of enhance my tone, texture, plump my skin, enhance my collagen, all those wonderful anti-aging benefits, but the other thing that I think was very impactful is we identified some benign cellular activity. We removed some abnormal tissue. There was a cyst that she removed that I was not aware of and had not had my dermatologist mention. So from a healing preventative perspective, I definitely feel like the resurfacing has not only turned the age clock back on my skin, and definitely the eye lifting has been, it's been spectacular. Everybody's commenting about my eyes. Brian's sister commented, pretty amazing, like immediate type of reactions. So I think that's beneficial. But the other thing, obviously more important, is to minimize any potential risk of skin cancer. And when you grow up in Florida, like I did, and many of you who are beach bound or sun lovers, sun worshipers like myself, at least I'm calling that myself in the past, not anymore, but it becomes really important that we take care of our skin. So not only are these procedures cosmetically beneficial and superficially beneficial, but they have a medical benefit as well. And I'm excited to share this whole entire process with you. See you later.